5:30 PM on Tuesday, April the 9th, 2024. I call this special meeting and board workshop of the Kingsville Independent School District to order. We have roll call. Joe Morales.
Here.
Martin Chapa.
Here.
David Garcia.
Here.
Joseph Reese.
Here.
James Glusing. Delma Salinas. Brian Kufal is here. Let the record show there is a quorum of board members present and that this meeting has been posted in accordance with Government Code Chapter 551, the State of Texas Open Meetings Act. We will move now to the moment of silence, which will be followed by the Pledge of Allegiance and the Texas Pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
All right, this meeting is being live video streamed. We're going to move now to item 4, which is the adoption of the agenda. But I want to point some things out to you. We are actually going to go through the board agenda through item number 6. We'll be going into the closed session. We will do item number 6A, B, C. We will come back and take any action that needs to be taken. We will then go into our workshop session, cover all of our budget information, and then we were going to go back into closed session for item 6D, so that we can excuse everyone else that's not necessary to be here. Do I have a motion to adopt the agenda?
So moved.
Motion made by Mr. Garcia,
Second.
seconded by Mr. Ruiz. Any discussion? All those in favor say aye.
Aye.
Any opposed? Motion carries 6-0. Item number 5, public participation. Ms. Bettis, do we have anyone who wishes to address the board?
No, sir.
All right, we move now to item number 6. The board will enter into closed session in accordance with the Texas Open Meetings Act, Texas Government Code 551.071 and 551.074 to deliberate and consider the following. A, consider and deliberate regarding resignation of contracted employee. B, consider and deliberate regarding employment of contracted personnel, director of technology. C, consultation with legal counsel regarding legal and personnel matters. No action will be taken until we return to open session. We are entering closed session at 5:33 p.m. matters which the board may discuss in open session upon which action may be taken. We are returning to open session at 6:20 p.m. Item A, discussion and possible action regarding the resignation of contracted employee.
Administration recommends that the Board of Trustees approve the resignation as discussed in closed session.
All right, board, you've heard the recommendation of administration. Is there a motion to approve the resignation?
So moved.
Motion made by Mr. Ruiz.
Second.
Seconded by Mr. Morales. All those in favor say aye.
Aye.
Any opposition? Motion carries 6-0. Item B, discussion and possible action regarding employment of contracted personnel, Director of Technology.
Administration recommends the Board of Trustees approve the following contracted employee presented for Director for Technology.
All right, you heard the recommendation of administration. Is there a motion to approve?
So moved.
Motion made by Mr. Ruiz.
Second.
Seconded by Mr. Chapa. We'll have a roll call vote. Joe Morales.
Nay.
Martin Chapa.
Yes.
David Garcia.
No.
Joseph Ruiz.
Yes.
Delma Salinas.
No.
Brian Kufal is a yes. That's 3-3. Motion does not pass. All right, we're going to pin the meeting at this time and go into the board workshop. So we move to item number 9 on the agenda, which is the Kingsville ISD Board of Trustees will conduct a workshop to discuss the following: A, budget calendar; B, fund balances; C, large expenditures; D, staffing; E, health insurance; F, stipends; and G, time clock.
Before we begin, I've shared some articles with you all about, we found like at least 4, but there's so many, about the state of finances in Texas public schools, and about all the districts that have adopted deficit budgets. It has some really good examples about what is occurring in every district. And that's just as a reminder that we are not the only ones in the state of Texas going through this. It's very important that we talk to our legislators about it, because the Texas school districts need funding. So there are references, articles that you all can refer to as you wish in your own time.
Good evening, Mr. Kufal. Good evening, Mr. Kufal, Dr. Pettis, members of the board. As Dr. Pettis said, these articles show that we are not alone, that a lot of districts and most districts are in budget crunch. And we're going to talk about some of the reasons why and what we can do about it tonight and where we exactly stand with our budget. But if you look at the articles, it says that so many districts are going into emergency mode and they are having to close schools, they are having to cut staff and really look closely at their staffing ratios. There was one article in here that talks about this is the worst budget that they've seen in 20 years, even during COVID, because during COVID they gave extra funding as well too. We're going to take a look at that tonight and see what can be done. But again, we are in a tight spot with our budget, but again, most districts in Texas are. So if you look at we're going to look first of all at the first item is a budget calendar. So Israel, could you bring that up, please? So right now, while we are working on the big kind of framework of this budget, TASB is working on a staffing study. And what they do is they look at the pay of every single employee and they compare it with the pay of other districts that are comparable to us, other districts with our same size. So that already began early March, and that should finish sometime in May, and then we will bring the results of the staffing study to you near the end of May and the beginning of June. You notice there's a workshop 6-4. There will not be a budget workshop at the beginning of May. At the beginning of the May is board elections. But the board elections, after the board election on May the 4th, it still takes about a week to 10 days to get all the provisional ballots counted and to get the curing done before we can finally canvass the results and swear in any new members. So there will not be a budget workshop at the beginning of May. Then June is when we again bring out the results of the staffing study. And we eventually then take that to the board to approve our compensation. That starts the budget as far as once we lock in the salaries, that's 80% of our budget. Then we'll know what we can do with the other 20% of our budget after the board approves that in June. And then you see in July, there's another big budget workshop where we bring everything else after compensation. Finally, we pass it near the end of August. The timeline is set where we have to get the property values from the county to be able to set our tax rates. So we have tight timelines and we're kind of at the mercy of the county until we can move forward. If you scroll all the way to the bottom, please, Israel. You see that we have the board meeting planned on 8/20 to discuss prior property values, and then finally public hearing and board meeting on 8/27 to pass the budget. Any questions on the budget calendar? Okay, let's move on to the next item. So the next item is our fund balances, and we're going to talk about 4 of our fund balances. There's 3 of them that we usually discuss. So can you make that a little bit bigger, please, Israel? So that first column is the general fund, and we're going to take a look at our revenues. So yes, perfect, and scroll down a tiny bit, please. The other way. Okay, so our tax rate is 0.78 for M&O, but if you look at our revenues, let's see, there we go. If you look at our revenues, our local revenues we're set at 9.3 million, and those we're doing fairly well on them. Our tax rate, we are collecting at a pretty high clip, so we're going to be fine there. We projected 96% tax collections. We should be at that or above. The state revenue, we also are doing fairly well because we projected an ADA of a little bit at 2,475, and right now we're a little bit above that, 2,486. We're 11 students over what we projected, but it does decrease at the end of the year, so we should be right on target for what we projected for our ADA. The one that's going to hurt us is this last one, $1.19 million there, because you notice one of the articles, it says that they are decreasing money for SHARS, and they are doing that retroactively to this year. So even though we set our budget with SHARS being closer to 800,000, we're projected to lose 300,000 or even a little bit more of our budget. So when we look at our revenues overall, we may have about $300,000 less revenues than we projected at the beginning of the year. Now, if you scroll down to the bottom, in expenditures, a little bit further, please. Keep going all the way to the bottom. Okay, perfect. So right now in expenditures, we projected a budget of 35.7 million. We are, again, budgeted for the worst case scenarios, and we are on track to not spend 35.7 million. We should spend less than we projected, which is going to mean that if you look right underneath, we projected a budget of 6.7 million. We will have a budget less than that. It's too early to tell how we're going to end up, but that is good news right now. You look at our fund balance, 14.2 million. We have really taken advantage of ESSER funds to build up our fund balance. Before ESSER came along, our fund balance was just over $6 million. So we, again, have taken the last couple of years to make sure that we are, even though we have had to use 20% of it for learning loss, and we did address many concerns for learning loss due to COVID, we have also used a lot of it to increase our fund balance because we knew this moment was going to come. We knew that ESSER was gonna end and we were going to have a budget crunch. And we're gonna talk about some of the reasons why right now. But if you look at it, at the end of this year, that's what was projected, 7.5 million. We're hoping to do a little bit better than that, hoping that our fund balance will be over 8 million at the end of this year. But if you look at it, let's say our fund balance was 8 million. If you look at a deficit of 6.7 million next year from 8 million, that will deplete most of our fund balance at the end of next year. So we're gonna talk about some of the things that we can do tonight for this next year so that we don't have a fund balance that's just a little over 1 million at the end of next year. Israel, could you please, well, never mind, we're gonna look at the next column right here. This is food service. We projected a deficit of $13,000 in food service at the end of this year, but that is a bright spot. We are running better than that, and we are probably gonna have a surplus of fund balance in food service at the end of this year. So our fund balance right there is 760,000. We're gonna do better than that. Now, the one, it's a good thing, but it's a problem that with food service, you can't carry too large of a fund balance. We're gonna have to use that. You can only carry 90 days of fund balance in food service. So we're gonna have to use that to buy more equipment that are needed or possibly offer more better food choices. But food service, we are in a good spot moving into next year. So other than that, we're gonna have to spend some of that money. Unfortunately, that money cannot go into the general fund.
What do you attribute that surplus to in food service?
Well, we really looked at, Ms. Butler and I really looked at staffing ratios before last year's budget, and we decreased staff by 6 overall in our food service department. So salaries are the biggest part of your budget. She's also, the other big part of it is she's worked to use a lot of USDA goods. And USDA goods, they're pretty much come free, and the only cost to that is transporting the USDA goods to our campus. So on the check register every month or two when they're transported, you'll see USDA commodity. It's basically transportation of those goods. So she's really worked hard to use some of the free things like milk, butter, cheese, and so on that we can get for free. So those two things.
Dr. Pitts, you said we lost 6 staff. Is that because we lost students and we had to make that much food, or?
Right, we haven't had the participation, right? That's the word I was looking for. Thank you. So she is funded with us, we are funded based on how many kids come to school every day. For her, it doesn't matter how many students come to school, it matters how many students take a lunch or a breakfast or a dinner. So, and Sandy rightly said that that's called participation rate. So the participation rates weren't as high as they were in the past, and because of that, she doesn't need to make as many meals, and she doesn't need as many staff to make as many meals.
So if someone comes to school, we get them for ADA, somebody doesn't feel like eating.
We don't get
credit.
We don't get credit for that.
There goes the waste of the food and things like that.
Exactly.
So with that extra money, then if there's equipment that needs to be replaced, it can come out of that fund?
Absolutely, yes. And we can only use that for food service expenditures, salaries, foods, and equipment. And we do have some aging equipment too that can be upgraded.
Thank you.
Yes, ma'am.
I have a question. Have y'all ever considered like hiring an outside company to come in and do our food service?
Our
Would
food,
that help us?
they would not help us because right now our food service is running so well that the amount of money that we get from the feds that can only be used for food service, we are actually going to be running a food service. The only time where it hurt us, where we had the deficit for a while, was during the pandemic. Because then we weren't feeding hardly any kids at all, and we really had a problem. But right now, it won't help our general fund. Okay, I'm gonna move to the next column, which this is another bright spot, which this column right here is our, if you could scroll up all the way to the top, please, Israel. This next column is our debt service. So we were projected to have $5.8 million from revenue for debt service from local. We're already over 6, and the year's not over yet. So we're doing really good. Again, we budgeted conservatively for that, but we're doing great on that. State revenues, we're not gonna get too much. This federal, that one's set, that's basically like it's a rebate from one of our bond series that we get that same amount every year. So we're gonna be above what we projected from our debt service. Now, unfortunately, we can't use that to help with anything with the general fund, but we can use that to do a defeasance to pay our bonds off a little bit quicker. And we're gonna take a look at that in one of the future slides. So we're doing good on revenues from debt service. If you could scroll down, please, Israel. Our debt is set, the amount that we pay is set. We're the 7.6, we only pay about $4.6 million a year on what we're required to pay on our debt. That other $3 million, or close to it, 2.7, is what we're gonna use to pay off some of our debt so that we can go ahead and pay off our bonds earlier. So we're gonna do a defeasance later in the year. You see right underneath it that we're planning to draw 1.4 from our fund balance to pay off additional debt. Our fund balance right now is 2.7, and again, we're gonna draw 1.4 of that to pay off the debt, and then we should have a fund balance of 1.3. You always want some in reserve there in case for some reason you don't collect enough from taxes for that year, but 2.7 is way too much. There's no reason for us to keep 2.7 in reserve, so we're gonna pay off some of our existing debt. Any questions on debt service?
Yes.
Yes, sir.
Did the homestead exemption apply, increase in homestead exemption apply to INS also?
It did. But because we increased the rate on the INS side when we reduced it on the M and O side, the total tax rate stayed the same. And really, it's the total tax rate that matters. Our taxpayers don't care how it's broken up.
Dr. Pitts,
Yes, sir.
we've done we've used defeasance twice, correct?
Yes, sir.
Approximately how much money do you think that's, and I know it's in the millions, right?
Well, we've completed one defeasance, which was, I think it was $200 some odd thousand. The second one we took to the board for approval, but it hasn't activated yet, which will activate later on near the end of the year. We're gonna have a whole proposal on that, but we're looking at paying off now $2.7 million of additional debt this year that we can use.
So, with the deficit that we're in because of the state funding, are you going to, suggest we attempt another?
We're gonna keep doing defeasances as long as there's talk that they're going to, that they're gonna do away with it, that they're not gonna allow us to pay off debt anymore after that. That's unfortunately, but we're gonna keep our tax rate to pay off our debt. It helps our taxpayers. And the reason why is every year we're paying interest on debt. If we can pay off that debt sooner, then that's gonna be less interest that's owed in the future. So again, what we're doing is we're kind of, we're saving our taxpayers money in the future. That's what we're doing right now. Because the sooner we get our debt paid off, the sooner we can really decrease our tax rate down. Okay, could you move to the next document, please, Susan? So we're gonna talk about, blow that up, please, nice and big. Why are we in the current state that we're at? I mean, you saw where our budget is. Now we're gonna talk about why our budget's there, and then we're gonna talk about what we can do about it. So the biggest reason is number one, TEA has not increased the basic allotment since 2019. We've had all this expenditures for COVID, which ESSER has helped, but during that, we've had problems with supply chain that has driven the cost up for everything. There's been the prices are not the same as they have been in 2019. Everybody can attest to that, but the state has not increased the basic allotment since that. The basic allotment is, right now, it's $6,160 per student, close to about $33 per day for every student that comes to school. There's other funding formulas that we're gonna talk about as well too, but 6,160 has been the same since 2019, and that's the biggest reason why school districts are all in such a big problem, because they haven't increased it. Usually, the state has a biennium budget. Every 2 years, they adopt a new budget. So they usually increase school district funding every 2 years, and you know that's gonna be your formula for 2 years. Well, they haven't increased it since 2019. Now, the second one is insufficient TA funding for special education students. This really affects our district because we have 20% of our students in special education. They are not giving the required number of dollars that are needed to educate special education students. So there are formulas for additional funding, but not nearly what is needed to help our students. Number 3, it's very small percentage more, but
We're at 16 and then now they're counting dyslexia kids. And so that's bumping it up. So we're about almost at 20%.
Yeah. Okay, the third one's affecting all school districts across Texas. They're experiencing decline in enrollment. You know what? During COVID, many students lost a lot of students. They got some of them back, but they didn't get all of them back. And that's not just our problem, that is a problem. And the reason why that's a problem is because they fund you based on how many students come to school. So since all school districts are having less students come to school, all students are getting less funding. Not only have they not increased the per student, all school districts are having less students that are coming on a daily basis. Okay, the fourth one we have beat to death, but that's over $1 million every year that hurts our district and several other school districts, but that's one that's unique to us, that basically the county has basically tax values that they set. The state has tax values that they set. And because of that, the state says you should be collecting this much, but because the county sets the values lower, we are not collecting that much. So the one that pays the penalty is the school district. We are not getting the fund. They have said that KISD, you should get this much funding based on the number of students and the type of students you have, based on the demographics, based on how many students below the poverty line, CTE, special ed. But at the same time, even though they're saying you should get that much, they're not giving us that much because they're saying we should collect more on our local taxes, but we're not collecting that because the tax rates are set lower at our county level. So that's a problem. That's a big problem why we're in this crunch right now, because we should have been collecting over $1 million a year for like the last 6-7 years. So we could have been doing a lot better if that wasn't the problem. And again, I know I beat this one, this horse to death for a long time, but it's a problem that really is affecting us long term. Staffing ratios, this is something again that all districts are now looking at, and we have been looking at a lot as a team, and we're gonna bring some of that to you today, but there will be more in the future. Amount of bond debt, and I'll talk about why that affects us right now, because you're gonna see what our bond debt is right now, but because we don't have any more bond capacity to fix things like roofs and parking lots and things like that you would normally go out for a bond for, we cannot do that with our INS fund. We have to use our general fund to fix those things because we can't go out for any more existing bond debt. So unfortunately, when we built the schools and the domes, there were some issues there where we really went out for more capacity than we could handle at the time. And then Mr. Krufall was here and remembers there were some problems with, it was over budget, and I mean, there were some big problems with that, and that really set us behind the 8 ball with our bond debt, not allowing us to do new things that we really need to do now, like get new roofs or buy new schools or so on like that. So I don't know, did you want to comment on that at all, Mr. Krufall, or not?
Well, yeah.
But that's part of the reason why right now if you look at number 7, going right underneath it, with our aging infrastructure, we cannot do on the bottom side what we need to do, and we have to do it out of the general fund, and that's hurting our budget as well. Number 8, pandemic learning loss requires additional student support and technology. We did get some funding from ESSER for that, but that funding is ending. Number 9, unfunded security mandates. We're required to do so many things at our schools for security. They gave us, for the longest time, they gave us about $15,000 to $20,000 a year for our district for that. Now, this year, they increased it to $75,000 for our district, but that doesn't nearly cover even our payroll costs for that, let alone supplies. They have given some big safety grants, but the problem is the safety grants do not cover payroll or cameras or all there's a limited subset of security expenditures it covers. For instance, it covers fences, so we're gonna use it to get our fences together. It covers the silent panic alert system. It covers those, the security film that we have on the doors and windows. It covers unusual things like they're called, I think, repeaters, where sometimes walkie-talkies, portable radios, they don't work really well in buildings because of the metal, but we can use the grant to get repeaters that bounce the signal off so that our walkie-talkies will work better. So we're gonna use those grants for everything that we can use them for, but the problem is you can't use them for salaries. You can't really use them for basically security cameras and so on. There's one small grant you can use security cameras for, but the big one does not allow you to use for security cameras. So it doesn't help with everything that we need.
Can you use Title IV for that?
You could, but we're using, all our funds are used somewhere else. If we use Title IV for that, then whatever is in Title IV is gonna have to go to the general fund. So it doesn't help us in the big picture.
Title IV, there's a component for safety.
You're right. We could take it out of Title IV, but then again,
It's like borrowing from Peter to pay Paul. I mean, we're still gonna have to use those funds for what we were gonna be paying that for.
right. And then finally, we talked about the SHAR's decrease in revenue. Now we're gonna be getting $300,000 to $350,000 less every year because now they've changed that, their funding formulas for SHARs. So that's the reason why we're in the pickle that we're in. Any questions on that before we talk about what we can do about it?
I know the state's talking about an ESSER board. I don't know, we spoke about that last week.
That would really help us. That would really help us.
On the staffing ratios, I know we're gonna look at that real hard, but based on how we're performing, I would hate to see a class of, a max class because we're saving money. And when kids really get instruction, so, and I know that's gonna be discussions coming up, but, it's something that we have to look real hard on in the testing area especially.
Absolutely. When we look at staffing ratios, there's ratios for every component. There's teacher staffing ratios, there's administrator, counseling, clerical, auxiliary, and believe you me, we are looking at them all, and in the discussions that we're talking about, that's one thing that we cannot decrease the quality of services, and we cannot, the primary goal or the primary function of our district is to educate kids in a safe learning environment. So safety is part of it, and buildings are part of it as well too, and all the other auxiliary personnel to get them in that safe environment are important too, but really it's all about educating kids, and it starts with the teachers in the classroom. So you bring up a great point, Mr. Medas, that we can't, and at the same time, we know that the path to a balanced budget lies in getting our staffing ratios in alignment, because otherwise we never will be able to balance the budget. So it's a balancing act. We can't completely radically do that, but at the same time, we have to do some things to balance the budget, otherwise we won't be able to balance it. Okay, I think we're ready for the next slide. Okay, so this really, I'm sorry, there was one more slide for the state of where we are, which is basically our debt. So blow it up a little bit bigger. Okay, that's perfect. Just leave that right where it is. So right now, you see that every year we are paying about $4.6 million. Next year is gonna be a year luckily where we only pay 4.38 and then 4.59. These may change a little bit because we're gonna do a defeasance. So, but right now, as you can see, we're paying anywhere from 4.3 to 4.6, all the way until 2033. That's really when we have a little bit more bond capacity. Not a lot, but we have a little bit more because you see that it drops down. Keep going down a little bit further, please, Israel, all the way to the bottom. Okay, that's good. Okay, then when we get to 2038, it drops down to 1.7. And then finally, we pay off all our debt in 2043. Now, the reality of it is that most school districts never pay it all off, because once they start getting low, then it's time to build new schools. And so it does decrease over time, and we don't want to really get to where we're maxed out on our bond capacity ever again, like we did when we built the domes in the high schools, because we really kind of overextended ourselves. But as you can see, it's going to be a long time where we're able to do some bond projects, because really now 2033 is when we have really any bond capacity, because at 4.6 we're maxed out already. Now, what we're trying to do with the defeasance is we're trying to escalate this by a couple of years. So, like, hopefully everything can go up by 2 or 3 years, depending on how long we're to do the defeasance. If we can do it 10 more years, we might be able to escalate the timeline by 5 years altogether, everything moving up. So that's what we're trying to do with the defeasance, to pay off our debt sooner, so that we are not in the situation where it's 2043 before we're paying everything off.
Vince, I just want to clarify, we talked about the right-hand column, that's the debt service, but our overall
Oh, yes,
debt
I'm
is
sorry.
$48 million, is that correct?
Yes, this is the principal right here. And then this is the interest that is right here. And then overall, this is what we're scheduled to pay off with principal and interest together over time. But we're hoping to decrease that by millions of dollars by doing the defeasance and actually paying off the debt early. But yes, thank you, Mr. Kufal. That's principal right there, that's interest, and then this is total what we're projected to pay off over time. Any questions on our debt right now? Okay, we're ready for the next slide. That's it. Okay, we're gonna review our large expenditures. First, the large expenditures are broken up into 2 categories. Only reason why is basically when you're doing major construction or renovation, it comes out of the construction fund. So, but there are some large expenditures that are in the general fund as well. In reality, it all comes out of the general fund, because what we do at the beginning of the year is we decide how much of the general fund we're gonna transfer into our construction fund. But for our purposes, all of these go together. So retention pay, and this is something that I really want, I would like to get some feedback on you. Our retention pay this year was $500. We budgeted $250,000. It actually cost us $231,763. Again, we're always conservative, and not everybody is always here on that, by that retention date. We're pending for this next year, 24-25. Israel, could you scroll down to the bottom, please? So this is a history of our retention pay the last 5 years. During ESSER, we paid $500. During COVID, before ESSER, we paid $150 to every employee that was there in 2020, 2021, and we paid $0 in 1920, because that was when we were in the midst of the pandemic and we hadn't had any ESSER funding yet. Before that, it was anywhere from $100 to $250, depending on how much money we have for that budget year. So if you scroll back up to the top, $500, there's no way that we can afford $500 now that Esser's gonna be gone next year. We're gonna bring something to the board, but I want a little bit of discussion from the board on what your thoughts are on this, moving toward next year. I know no one wants to be the one to say that we don't have the money that we used to before.
And knowing that, you know, I'm not worried about the area or what they pay or anything, I'm worried about us, what we got to do. We, regardless of our calendar, we still lose people. So that's something that we have to take into consideration is how are we gonna keep people and how, you know, and the whole state's in the problem, I understand that. But what are we gonna do to keep good people? That's a big question, where are we gonna take from to keep, to fund that, because, you know, it might not, I mean, it's $500 is a lot of money for a lot of people. And when staff hears that we're not getting that, that's already a negative, that's a red flag already. What else are we not gonna get? See, so, and moving forward, we really need to look at this hard, and I know that it's a lot of money, like you said, but, you know, saying you're not getting anything is already, that sets red flags up. And you people that in the classrooms and on campuses know exactly what I'm talking about.
Yeah, we don't wanna say they're not gonna get anything,
Right,
that's not what we're indicating at all.
No, I understand that, but, it has to be something. I don't know how or where, but, that's something we really need to worry about.
When we talk about, it's called retention pay, but in reality, it's given in the middle of the year. So they've already made their decision in the summer where they're coming back. A lot of it is salaries, when we look at salaries that are gonna determine whether they come back. But as Mr. Mida has pointed out, a lot of our employees, that's a time of year that they're in a budget crunch, it's the holidays and everything. And Dr. Pettis, one of the nice things she did when she came in, we used to give our retention pay in December. And it has been moved up to now November, before Thanksgiving.
Just because we know that people usually shop around Thanksgiving
Yeah,
holiday.
that's really nice.
So, but again, we wouldn't recommend nothing at all, but again, it's obvious that we never had above 250 before COVID, never. So if like, let's say that 250 would be half, that would basically cut that. I mean, you're saving over $100,000, but that's something that will eventually, these are the initial discussions of the large expenditures, but that's something that we always talk about every year, but we knew that once Esser was gone, there's no way we could afford that 500
I
anymore.
think it's just a matter of getting creative. And, you know,
We
there's a lot of stuff that maybe we need to cut back on.
We need to look in every single area. So we're gonna bring everything to you, and nothing is off the table, basically, because, and it's the same for every district. Right now, every district is basically going to emergency mode because of all the 10 reasons that we talked about right there. Okay, fleet vehicles, $115,000. Last year, we bought a 15-passenger van. Well, we ordered it, but it's not coming until the summer. We got a truck and some SUVs, and we're looking at keeping the same budget for vehicles for next year. Automotive pave booth, that's still pending. We haven't moved forward. We should need that next year. Gillette fence. So this bottom is construction, but it's just a matter of the account. It's still large expenditures that will eventually be attributed to the general fund. The Gillette fence, we moved to zero because that's gonna come out of the safety grant. That's one thing that it does cover. So that is a benefit. The roofs, boy, it would have been great if we had bond capacity and all of those could come out of the debt service, but unfortunately we don't have any bond capacity. We are posting in the paper on Thursday. We have we had to revise everything because vocational building A is the one that is next to the parking lot that has the electrical circuits in it. So that one is the one where it's leaking through the roof, and something needs to be done because it's not up to fire code right there. And the problem is that that's where it houses the electrical facilities. Building B is the one that's parallel to the tennis courts, that building there. And that one, we had originally planned to do a repair on that roof. But before we did it, we had an infrared scan of that building, and it has shown that water is leaked all the way down in, so that one cannot be repaired anymore. Unfortunately, that one needs to be replaced. So we had to get all new specs on getting that roof replaced as well too. And that was not originally in the budget for replacing it, unfortunately. Repair on Memorial, that one was budgeted, and again, we're waiting bids on all three of these. And in about a month, we will bring those bids to the board, and we will decide whether to move forward with those items. The next roof that's leaking next is the admin roof that's leaking in several places. That's something that we may want to consider for next year, because again, the more water damage you have, the worse it affects the building and the more costly it's going to be to repair in the future. We're going to have a roofing presentation in the next couple of months as well. Parking lot, these other ones took precedence over the parking lot, but the parking lot, we're considering bringing to the board some options where we only do the worst areas by the tennis courts, because some of the other things, the roofing looks like it may be over budget because we have to replace another roof, and the track was over budget. This was originally a CASB estimate of what it would be for the track, but it ended up being more once we got the bids in. You never know really till you get the bids in. It's an estimate, and at the same time, we hired a private company to make sure they did the soil samples to make sure it didn't sink down. That was about $30,000 as well too. So you see what we estimated the construction fund this last year, the total. This next year, we're not gonna have a lot of money to do a lot of repairs next year. So we are gonna be bringing a lot less to you this coming year. I'll take any questions that you have on the large expenditures. Okay, next slide, please. Staffing ratio. So again, you saw in the articles that all districts now are looking at staffing ratios. When ESSER came along, part of the thing with ESSER was to have money for additional staff so that you could address learning loss, and they did that. If they came out with ESSER 4, that would be wonderful. Then we could keep the ratios where it is to address learning loss. But now that ESSER is ended, and now the extra funding for these extra personnel to help these students is gone, now we have to look at getting our staffing ratios in alignment. So you see that we used to have, in 2018-19, we had 16 students for every teacher. Then in 19-20, we had 15 students for every teacher. Now, in order to address learning loss, it was expected that we would go down and provide more staff to address that learning loss. And since then, we've crept out and we've tried to start getting back to 14. It really eventually needs to be back to 15 to 16 to help us to balance the budget. And again, we're not talking total. Now, you think 14 students per teacher, you think, wow, that's a pretty good ratio. But that includes everything. That includes like special education. For instance, that includes inclusion teachers that don't have students, or it includes some special education classes that might have a ratio of, let's say, 3 students per 1 teacher. But on average, we really need to get back up to 16 for teachers to balance the budget. And you see that we've done a little bit better job without without completely raising class sizes to balance it. Now, here with this is total staff on this side. You see right now, total staff 448, 474, 483, 441. Now, this is FTEs. So, like for instance, we have transportation staff that don't work 8 hours a day. So they're not counted as a full FTE. Like right now, we have 454 teachers, but we have less than that for FTEs right now. So you see that we were kind of in the caution zone in 2018-19. That has been something that for many years, we haven't really looked at our staffing ratios. That's something that we've just really started working in the last several years because we knew that it was going to be a problem in the future. But in the past, it was always, before this and going 10 years back, it was, you have this position, you're going to keep this position forever. You're not going to look at how many students do you have, so how many counselors do you need to have, how many maintenance workers do you need to have, how many administrators do you need to have. Now we are looking at that every year with every position. We need to get back up to at least the 7.4 would be great, but you see the minimum, the bare minimum that we get graded in teams every year. The bare minimum is we need to have a ratio of 6.3 students for every staff member. Right now, we're at 5.9, and again, during COVID, it was expected that we would drop down. They gave us extra money to be able to help students for learning loss, but now that we're coming out of COVID and now that ESSER funds are ending, we need to make sure we get our staffing ratios back in order, at least at 6.3, and it would be better if we could do 7.4 where we used to be in 2018, 2019. But again, we are not alone in this. Again, all school districts are really looking at their staffing ratios to make sure that they can balance the budget because, again, they have not raised the funding formulas and now we are losing ESSER funds. I'll take any questions you have on staffing ratios. But this is something that we meet with, as a leadership team, we meet with it. And a lot of times when we look at, we are not looking at eliminating anyone's job. We want to make that clear. We are looking at doing this through attrition. So our normal procedure is when an employee leaves a district, we look at that position. Is that one that, according to that particular position, let's say groundskeeper, is that one based on the number of acres that we have, we can absorb when a groundskeeper leaves? And the question is it a yes or is it a no? If it's a yes, then we absorb that position. If it's a no, then the question is, can we move somebody else into that position from the district instead of hiring from the outside? And by doing that, by going through attrition and going through that process, we are looking at reducing our staff through attrition to meet the staffing ratios, but still at the same time meet all the needs of the district.
I have a question.
Sure.
Going back to ESSER.
Okay.
How many employees were funded with ESSER, the ESSER grants?
I don't have that offhand, but
And then I was wondering, like, was it indicated in their contract that that they were grant funded, upon, the grant ending, they would no longer have a job, like we did with like 21st Century Grant, and,
We haven't seen that in a very long time.
no,
well, we did that in our
Right.
district, when we got the 21st Century Grant, when it's over, you don't have a job.
There was a period we did that, but it had been a long time that the
So you could have
ISD,
saved.
they would always find another position. It was very rare that he would actually.
And that's okay if they find another position, however,
They were made aware.
they were made aware that they were grant funded, and
And it was in our contract then?
yeah, upon completion or end of that, the grant.
you're talking about the 21st Century Grant, not the ESSER funding,
It
right?
was,
Well-
it was way.
No, it wasn't ESSER, but I'm just saying with ESSER, do we have that indicated?
No.
But I guess more or less how many positions were
Okay, we
created with ESSER?
can get that.
Because it was millions of dollars, I don't know.
And now we're trying to go back to our
Yeah.
pre-COVID, pre-ESSER ratios, and it's gonna be a challenge because now, you're used to operating with that team.
We had a lot of them, yeah, pre-COVID.
We can work on that for you. Okay, next slide, please. I know that was two of them, but I think it was also maybe some of the ITC, is it like, we'll take a look at that. Okay, so health insurance costs. Health insurance costs are a major portion of our budget. So this is how much the district has spent the last several years. So going all the way back to, scroll to a little bit further down, please. Okay, that's all the way to 2011-12, but let's put it to where we can see at least this year as well, too. 22, 23 right at the top of the screen. A bit more, two more. Okay, one more, and you don't need to make it bigger, that's fine, and it's okay if one drops off. Okay, so this last year, basically, if you round it off, $3.1 million we spent in 22-23 on healthcare costs. So the employees in their premiums paid about $500,000 of that. The district paid $2.6 million of that. So we're looking at decrease, again, $2.6 million for the district. That's one of our major expenditures. Like you have, at the very top, you have, first of all, your salaries and benefits. That's the biggest part of your budget. Well, healthcare is the very next expenditure that we have after that. Then we move into property casualty insurance, and then you move into technology and special education expenditures after that. But it's a major expenditure, so that's why when we talk about putting everything on the table, everything on the board, what can we do with healthcare costs? And compared to other districts, we have been doing pretty good in managing our claims. Like you consider that every year, your healthcare costs usually should go up about 10%, 8 to 10% every year, but 10% just to be safe. And you look at it, like if you look all the way back in 2012, 2013, our healthcare costs were bigger. We had more employees then, but at the same time, you would expect that overall, our healthcare costs would be greater now than they were back then. Now, I want to point out something right here. Look at 2018, 2019, 3.8. We haven't seen healthcare costs like that since 2018-19. Now, something major happened here. This is where we used to work with Gallagher, and they had high overhead costs, and that added a lot to our health insurance costs. This is where we took it over as a district and decided to do it on our own. And that has drastically decreased healthcare costs. And even though it went up a little bit more after the pandemic, like it went down obviously during the pandemic because people didn't go during those years right there. But even after the pandemic coming out, here people did a lot of elective services coming out of the pandemic. And then here it even decreased last year. That's because of all the great things that we are doing by managing the plan locally. So we have done many things, like for instance, we have decreased the co-pays for going to the doctor so that they would stay out of the emergency room and urgent care centers. We have tried to really push CVS because we get the greatest discounts with CVS for our pharmacies. And Sandy, I don't know if you want to talk about that a little bit.
We've also pushed the telemedicine, where we educated our employees that they don't even have to pay the copay. So it's assisting them, especially through COVID, after COVID. They don't even have to go and pay the $20 copay that the doctor's going to charge them. So we're educating them with getting the mobile app, looking at what doctors are in the network. So just guiding them on a one-to-one. What is it that they could do to bring a lot of cost savings to them? So, and pharmacy is one of the biggest things. I mean, I give them examples all the time. Our team gives them examples. What is it going to cost you if you go to any of the alternative? Because of cost savings, because CVS is in conjunction with Aetna, there's a big cost savings. And so that's what we're trying to do. If they have medication that they take on a regular basis, they have the 90-day supplies. A lot of times it's free when they're used to paying it at another pharmacy. So it's all about guiding them and educating them what type of benefits they have and how they could utilize them to really save them overall completely.
Now, does the decline in what has been paid out, is that due to also not any major medical type things as far as people going in for big thing, cancer, things like that?
Yes, that is as well. In the long run, it averages out pretty well, but it's always a balancing act every year. We have something called stop loss insurance that our employees, if they go over a certain amount for an individual employee, then the stop loss kicks in and pays that. Now, you can decrease the stop loss amount and say, hey, I want you to pay me everything over 100,000, but you're gonna pay more in stop loss premiums by doing that. So it's always a balancing act. In the last couple of years, what we've really done is we've analyzed data, how many of our employees on average go over that stop loss limit, where it's called an individual stop loss limit, an ISL. We've done a really good job about managing that in the last couple of years. So you almost need to plan how many of your employees are going to need that type of coverage. You don't want to plan too little and you don't want to plan too much. But we have done fairly well on not having any super big claims recently.
Dr. Pitts, our consultant is present, and I want to just acknowledge him, Mr. Phil Esquivel. Share a little bit with us there, Mr. Esquivel?
Sure. Hey, number one, I just want to thank Dr. Pitts and Sandy for listening to the recommendations that we give them, because bottom line is what we're trying to do is reduce claims by giving them a preventative measure using telemedicine, using lower co-pays for an urgent care. We have, we went and got an agreement with StatCare and Castañeda that it's only a $20 copay and a $30 copay. Instead of going to the ER, we designed the ER, we raised that copay a little bit so they wouldn't, because the ER is like $5,000 every time they go in, and we're getting beat up. So, we just tweaked it a little bit and raised that copay, and so people start realizing that it's cheaper to go to StatCare and Castañeda for because they're open later, and even though access. And the other highlight, I think, is that, we're back with the SPAWN network again. And, but that was like a really, a hard, they couldn't give us the contract info, but the bottom line was when SPAWN comes up and tells you, hey, look, man, I'm not getting enough money from you. Y'all need to either increase the pay or do something, because you're going to be considered out of network. What's that tell you? That tells you that we're getting the lowest, the best reimbursement and the best discounts that we can get by utilizing that network, staying with Aetna, because Aetna, they make the agreements on the reimbursements for medical care. And so now they can go back to the SPAWN network. And now we'll see what the renewal will be, because, something had to give somewhere there, and we don't know where that tweak is going to come up, because we got another renewal for another year at the same, they're going to come back eventually to get their money back. That's just the way it works. So, but, again, we're being a little more preventative. So we talked about some suggestions to, raise contribution rates if you wanted to. And again, it's up to you all. He'll tell you about it more. And did a real thorough, research to see what other communities are paying their teachers, and he'll give you that too. So, it's a good team. Mm-hmm. And as you can tell, I came in at not 2019, 2020. That was Gallagher at 3.8 million. And just with the changes that we've been doing, we've been able to save, that's 900,000 on that year. That's another million. That's like 1.6 million. 2.5 million we've been able to save over this period of time that you've been able to utilize elsewhere. And we still got a pretty decent fund balance in there, but it would certainly be better to beef it up, just FYI.
And I also think our nurses did a good job in the prevention,
Oh, yeah.
because, well, I mean, we pushed it, we pushed them to mask up and do this and separate and do all these things, so all that working together, I think we saw some good things happening. We gotta give it out to our nurses as well.
We got a good team.
Phil brings up some really good points. You know what, this happens a lot of times. Every once in a while, you have a hospital system that wants to negotiate their rates because they want to make more money. And there's always a negotiation. This time they really played hardball, and it ended up being a good thing, because in the end, we didn't cave in to their rates. And at the same time, a lot of our employees went to HCA, which actually was offering deeper discounts then, so they were actually paying less money by going to HCA during this time. So unfortunately, SPA might have lost out a little bit. We'll see. But again, we did not give in, and we held the course. They wanted us to cave in earlier and to just give into their rates, and we did not do that. So
I do want to add, under the direction of our superintendent, Dr. Pettis, we did play hardball. And we had a meeting, and we offered alternative measures, and that was guiding our employees to providers in the network. So we did have a few who did need to have surgery, and so it was literally taking them by the hand and saying, look, your percentage going here is going to be a lot better. And in doing so, it also brought a great return. You know, so there was a lot of cost savings. With the guidance of Mr. Esquivel, we teamed up with Texas A&M, and we've held 2 mini health fairs with our auxiliary staff to get some blood work done, for them to get counseling, how to do preventative care for those that either are diabetics, have high blood pressure, how they can save, what programs are out there where it's not costing the district, because whether based on income or programs, they can get it at a lower cost or free. So it's going to be about, moving forward, it's going to be about cost savings for the employees and how they can save and manage also their health at a greater level. So
all of these different ideas that we talked about are savings for both the employees and the district. We are looking at trying to do even more, trying to revise the plans and guide employees so that they can save even more money in the future. Now, with all of that said, healthcare costs increased by about 10% per year. So we have not increased employee premiums in several years, and that we're going to take a look at the need for that is going to have to increase a little bit every year to keep in line with increasing prices. Now, if you flip the page to the next section, this shows where we are. If you look at, I'm sorry, we're still waiting for the next topic.
Hey, Dr. Pitt,
Yes, sir.
just FYI for the board, just to know that we're a self-funded plan. We're not a fully funded plan, which means with a fully funded plan, they say, hey, you're gonna be paying, $4 million a year. And no matter what your claims are, that's your cost every year. Versus what we're with right now, a self-funded plan, we're responsible for any cost up to like $175 per employee. That's our response. Anything after that, we got a third party insuring the big bill. And so, but the thing is that the money that we save, because 4 million versus the 3 million, we get to keep. You see, so that with a self-funded plan, you're able to keep the savings versus a fully funded plan. It don't matter if you saved, you implemented where you saved claims and you saved 50%, you're still going to have to pay that fully funded $4 million premium. So that's a difference between the types of plans that are out there.
So you're right, and you can take advantage of rebates on pharmaceuticals, and so it's more work to manage a self-funded plan. Like a lot of times with a fully funded plan, you can almost set it and forget it. But But you can have greater opportunity to save money by doing that. Okay, so let's look at the employer contribution. We've been at 479 for a while now, and look at how much other districts are around us are contributing to their health plan. So on average, other districts are contributing $306, and we're contributing $479. So we're contributing $173 more than plans the same as TRS. In other words, if we were going to consider that, first what we would do is we would consider matching our benefits on our plan to what TRS is, which would mean less benefits, obviously, because TRS doesn't do as much. So, I mean, that's something that employees are used to, and it's something that's not sustainable, unfortunately, if we're gonna keep our salaries on track with all the other districts when we are paying so much more for insurance than the other districts are.
And I think the other thing that's important for us to understand is that when you're on TRS, you don't have anyone in the district who's dealing with insurance. You send them to TRS, call TRS.
Right.
And we have to have employees here specialized in this and able to handle this and administer that. So it's an additional cost to us.
But there's a lot of changes, even before that's even a consideration. Dr. Pitts and I and Mr. Esquivel have talked about, there's a lot of changes that can, because that's cold turkey. I mean, that's like drastic. There's a lot of things that we could do. For instance, we've got 143 employees who go to HEB. And not that we don't want to give
For
HEB
pharmacy.
business for pharmacy, but that's not where the cost savings, they don't compare to CVS. So what we plan to do is have a one-to-one with those employees and let them know, look, this is what you would save. Possibly pay close to nothing for your medication. We've got another 132 that go to Walgreens. Walgreens is wonderful and great. Unless they can match CVS, our employees need to go to CVS. Walmart has 74 employees. If they're not being competitive with the pharmacy costs, then we don't need to be doing business with them. But that is going to take manpower, which we will do, is sit with our employees and let them know, these are the medications, you're going with the 90-day supply. Do the mail order, because all of that is going to be little or free to you.
You know, with the county, Mr. Esquivel takes care of us, and Mendoza was doing our medications for free. Mendoza is no longer in existence here, but Falfurrias Family Pharmacy, guess what? For free.
Mm-hmm.
Mr. Esquivel, that'd be something, maybe we can bring them to the table. Who knows? And when it comes to medications, you know, all of us can save some money with those
That's
and
right.
not pay a single
That's right.
a penny for that. So that's something I think we need to do. One thing that the county does real good, Mr. Esquivel does in his group is, and I don't know if we've done it, I think we did it when I first came on board. I think, Ms. Galindo, you were, and Dr. Pitts were doing that, you all met with all the, and I don't know if that's been done again since.
Yes.
Okay,
We
good.
do it on a yearly basis.
That's good.
If you could go to the next slide, please, Israel. So what we've established here is that KISD is paying more than any other district around, and our employees are paying less than any other district around. So what is our proposal for next year? So I want you to look at our 4 plans. We are an anomaly where we have 4 plans, and we're recommending 3 plans for next year. So you look at the first plan, high deductible plan. That plan is the most cost-effective plan in any district. Right now, it's running at a loss ratio of 70%. That means that for every $100 that come into the program, only $70 are spent out. So it is a bonus. That's why it's in green right there. Now, to be mentioned that it is mainly, you know, a major medical plan. You have to go to your deductible first. But what it does is it insures you against catastrophic loss. If, like, you had a huge expenditure that was, let's say, $50,000, you would be capped at your maximum out of pocket, and you would have a deductible and everything. So this, right now, on this plan, we have, trying to get this. No, I'm trying to get the laser to work. Okay, well, you can probably see in yellow there's a 51 in yellow. That's how many employees right now are on high deductible. That first line is employee only, 47 employee only on high deductible, then 1 employee spouse, 2 employee children, 1 unemployed family. The more people on that plan, the more the district is going to run at a benefit. Because in green, it's running at a 70% loss. So what we don't want to do is increase those premiums too high, because that'll draw people away from that plan. Now, scroll down to the next plan. The next plan is the narrow network. So what it does is employees have access to the hospitals that have the largest discounts. It's a narrower network, but those are the ones that are gonna save the most money for the district and for the employee. That's why the premiums are cheaper. So that one is running at a loss ratio of 92%. So for every $100 that goes in, only $92 goes out. So the more people that we can draw from higher plans into the lower plans, it saves the district money. We have 65 people on a narrow network right now, and you see the breakdown. The broad plan we are looking at for next year, broad plan has a loss ratio of 111%. That one's losing some money. For every $100 that comes in for funding it, $111 goes out. But there's the most people are on that plan of any plan. 219 people total in our district are on that plan. Could you scroll down to the bottom one, please? So the bottom one's the plan that we're proposing to eliminate. It is the one that has the richest benefits. And look at the loss ratio on that plan, 180%. For that plan is losing money. For every $100 that's going into that plan, $180 are going out of that plan. We only have 40 people on that plan. So those 40 people, when we eliminate that plan, would have to go somewhere else. They're probably going to go to Broad 1, which is the next one that offers the next most benefits. Now, I do want to say that our broad plan is really like the high plan for every other district. Our high plan offers greater benefits than any other district's plan. That's part of the reason why it's losing money left and right. But this plan right here, this broad plan, still is going to be comparable to any other district's high plan. So even these 40 people, they're going to be going and they're going to actually be paying less premium next year because they will be going down to a plan where the premiums are lower. They'll have their co-pays and so on will be higher, but they're going to be paying less in premiums for next year. But again, that plan that offers such great benefits, there's a reason why it's losing money, and there's a reason why nobody offers benefits like that. That's what we're proposing, going down to 3 plans for next year. Now, if you scroll up to the top again, so we're still, for next year anyway, we're still proposing keeping the district contribution at $479. But to get our fund balance to a healthy level, the premiums are going to need to increase for the first time in a long time. And again, right now, even though they're increasing, they're still going to be at a lower rate than they were 10 years ago because there was a big where they decreased it 10 years ago. So here's KISD right now, currently. Here's the average. There are 2 options that we're bringing to the board, and we're not voting tonight. We just wanted to have a little bit of discussion. Option 1 is decreasing from $0 to $10 for the employee only. Same thing on option 2. There's a reason why for the high deductible, we're not trying to increase very much because the high deductible is catastrophic insurance. We don't want the high deductible premium to get anywhere close to the other ones because if they can think, hey, I'm going to pay almost the same premium and get a whole bunch more benefits, then they're going to go for the higher plan. And that's going to cost the district a lot more money. So the goal is to keep the high deductible plans as low as possible for the employee. You see, most of them, the employee, 47 people, it is just the employee. So for 47 people, it'd only be a $10 increase. We want to keep as many people in that plan as we can because it's running in a loss ratio of 70%. Scroll up to the next one, please, to the narrow plan. So option 1, we're proposing increasing by $28 and scroll. Oh, I'm sorry. Oh, I see. I'm on the wrong one. By $21 on option 1. Option 2, we're starting looking at staggering. The reason why is this. You notice that we are so far off the average in everything like spouse, child, and family. So far, On option one, it would be an increase on $72, option two, $57. Let's talk a little bit about what these mean. Really, option one, it's a bigger increase. And this is really probably what we should be doing. Option two is a smaller increase, and that is really the minimum that we can afford to increase. So again, this is more in a line, getting us not anywhere close to other districts, but starting to get us in a line, because if you look at, scroll to the top again, please, Israel. If you look at the average, that's really what the other districts are paying. So scroll down to the broad plan, the one that we have more employees on than anything else. This one has bigger benefits. Instead of the narrow network where it's only really one or two hospital networks that have the greatest discounts, it has more options. But with those more options, you have greater costs, because you're not going to just have the ones that have lowest discounts. But this is the one that we have most of our employees in right now. So right now, again, we have 219 employees in one of these plans. Other districts for employee only, the average is $113. Ours is $56. On option one, we're planning to go up to $83, which is a $28 increase. Now, other districts are still at $113, so we're still well underneath. Now, here's where we start to have the difference in option one and two, because we are so far off the other districts. Like if you look at right now, we're paying $340 a month. Other districts are paying $713 a month. So we're looking at increase. But still, part of the idea is now we have to get our employees to understand that every year it's going to increase a little bit. That's what other districts do, and that's what's needed to keep pace with rising healthcare costs. So I'll take any questions that you might have on this sheet. The good thing is we're looking at this well ahead of time. These changes wouldn't go into effect till January 1. I mean, we're going to look at salary increases as well too. And when we look at what we can afford and what we're bringing to the board, all of these go together. It should be that their salary increase should be able to cover the cost of the rising healthcare plans. But again, you see that it's not a big increase compared to where we are with other districts. We're still going to be well below what any district around us charges for their premiums.
This will be communicated to them after we approve the budget?
After you approve the budget, right, because then we'll know, and it'll be plenty of time, because we finally approved the budget in August. The changes to their health insurance won't happen until January, so it's gonna be communicated well ahead.
Okay.
And in that process, we sit with the employee on a one-to-one. So that's when we go over their entire benefits and bring guidance based on their need, based on their health, which plan would benefit them the most. So we are continuing as a district to do that, to help the employee along the way.
And then they just choose.
And then they make the
once
decision
Okay,
once they have reviewed the benefits.
So every
Thank you.
employee gets a one-on-one.
Every employee gets on a one-on-one.
If they want it, they can sign up to do it by
Oh,
themselves, like
so they don't
online or
necessarily
whatever.
get-
We're at the campuses, so there's normally about 5 staff members, and so we're there sitting with them. Now, if they decide to not ask us any questions, they have that, and they just want to do it, self-enroll, that's fine, but we are there available to help them.
So there are options where, even though premiums are increasing a little bit, that employees can see a total decrease in how much they spend. And there's a couple of reasons why. One, we've talked about all the things like using the network, using CVS for pharmacy, using Teladoc, using the urgent care and the doctor instead of the emergency room. But there's another big one now. You see that so many of our employees, please, I want to get the broad and the narrow comparison. The other way, please. Those two. So we only have 65 of our employees on the narrow plan. The main difference is that the narrow plan offers the greatest discounts because it uses, 1 or 2 hospital settings. And some of the employees with modest increases in the premiums may decide, hey, instead of the broad, I want to move to the narrow. I can get the same quality care. It might be a hospital that I haven't gone to before in the past, but I can get the same quality care and pay less, and they can decide, hey, you know what, I want to move from broad to narrow because it's going to save me money. It'll save the employee money, it'll save the district money. The more people that move from the broad to the narrow and to the high deductible, the more that it saves the staff member, the more that it saves the district. So part of that is to encourage them to go to where it's going to be the biggest bang for their buck. And it's really educating the employees and making sure they're aware of the options. Hey, did you know that your employees, your rates can decrease significantly if you go to the narrow? Here's what it would entail. You would be going to this hospital network, but they will take care of all of your needs with the same level of service.
Dr. Pitts,
Yes, sir.
so are you gonna cover this during orientation or during convocation?
Yes, we're gonna roll it out when we bring in employees. And again, like Mr. Minella said, that's gonna be plenty of time because nothing would change till January. So we will talk about this.
And it's a lot of information, it's very, very confusing, but that's every year. So it does need that personal approach, and that's why we dedicated that, we made sure that that happens every year.
We might find employees who never see the doctor that are on the broad plan, the 219. If you never see the doctor, you don't have any pre-existing conditions, you don't take any medication, there's no reason to be on the broad plan. And it's letting them know that information because they would want to go to the narrow network. Because in the event that you need medical care, then you're just gonna stay within the provider list that is gonna bring the maximum benefit to the employee. And on top of that, help the district.
So potentially the increase in premium can be offset if we reconsider increasing salaries, but also the cost savings that they receive by taking advantage of all of them.
Exactly. So if they know that, if they know that, then they're going to go to the places that are going to give them the bigger discounts, and it'll save them money, and they should end up, if they're educated, hopefully spending less out of pocket altogether. But in the long run, it's something that, again, our employees haven't gotten used to, that, you know what, premiums are going to increase every year. We're not trying to do something drastic. We're trying to keep pace with inflation. But eventually, that's the direction where we're going, where we're to be competitive with other districts on salary than our healthcare costs. And unfortunately, when people are looking at coming to our district, they don't break down all the healthcare costs like this. They look at salaries. And that's what has hampered us in the past, is being able to be really competitive with salaries, is this. So in the long run, we're gonna have to get in line with other districts eventually over the long run. We just are gonna have to take our time and do it over time so that it, we don't want it to be a burden on our employees. We sure don't. Okay, any other questions on healthcare? Okay, stipends. I know this is a lot of information, but it's information that really is necessary since we're having to analyze everything right now. We really are not recommending very many changes in stipends, and we will not be passing this now. We want to answer any questions you have now about it, but until we pass salaries, that comes right before it, and then we usually pass stipends in the same budget meeting afterwards. Anything that's a different color is a change, so if you could scroll down a little bit, please. Let's start. Okay, so we're proposing a stipends in high to need special education areas that we haven't had in the past, because we are actually lucky that we have Diags.
Oh, you're on the.
Oh,
I think
oh,
the
I'm
first
sorry.
page is athletics.
Can you go to, let's bring up the other one first, and then we'll keep this one, sorry about that. Okay, so let's look at athletic. I'm gonna talk about some of the change, no, I'm sorry, not that one. Oh, no, I'm sorry, go to the other spreadsheet. It's the other tab on the first spreadsheet. So go to the other tab on the
Tab
first
on the
spreadsheet.
bottom.
There you go. Okay, and make that bigger. Okay, scroll to the top, and we're only gonna look at the ones right now that are different colors because those are the changes. And I'm gonna talk about the changes, and then I'm gonna let Mr. Garcia talk a little bit about some of the reason for those changes. So we're proposing an athletic coordinator stipend. This is something that other districts have. The amount is there. We didn't have it last year, but it encompasses a lot of other stipends and duties that are gonna be absorbed. So if you can scroll down to some of the purples there, like for instance, look at that first purple one, football equipment manager. We're looking at eliminating that stipend, and that would go under the umbrella of athletic coordinator. We're gonna skip football for now, but you notice if you look at the varsity video coordinator, that one we're looking at going down from 1 to 0 because that will be absorbed under the stipend for athletic coordinator. Varsity assistant, we're looking at going down from 3 to 2 stipends. And scroll down. Oh, freshman football. Freshman football, we're looking at going down from 4 to 0. Strength and conditioning, we're looking at going from 1 to 0. That $4,000 stipend would be included in the athletic coordinator stipend. So we're looking at absorbing a lot of those stipends and one of the freshman football stipends into the athletic coordinator stipend. And Mr. Garcia will talk about that in just a minute.
Let's talk about it right now.
Okay, Mr. Garcia?
Because we're going from 65, 75. I mean, offset the 13,000.
Okay. Well, I can offset the 14,000 because, like if you look at overall at the bottom, there is a net decrease in the amount of athletic stipends. Last year.
Let me change it.
Okay.
Let me ask you another.
Okay.
Of these stipends that we have this year.
What is going into that 13,000?
No, how many different people were those? How many people were double dipping?
What do you mean by double dip? I guess they did have more than
One duty,
stipend,
one
one duty. Coach Harris, Coach Rios, and then, like Coach Harris was strength and conditioning, Coach Rios was equipment and video coordinator, and then assistant girls soccer was another one.
All right, but they do other things too. They teach or something.
Yes, sir.
Will this athletic coordinator teach?
Yes, sir.
Okay.
So it's not a new FTE, he's still teaching classes, and it's just an additional duties, like if it was like coaching duties.
All right, if it took 4 or 5 people to do all of this, can you have one person teach and accomplish all of this?
It was 2 different people, but, yes, Coach Harris, or, if it was Coach Harris, like we were saying, who did the duties, I know he can handle it, or if it's another coach, they can handle it because, that's just, in my opinion, the type of people I hire. That's what we do. We try to make sure we do everything we can for the kids and what's best for them and get them their needs. And we put in the work we need to put in to make sure they get that. It was 2 different people, but I firmly believe one person, yes, could accomplish that.
So these stipends, are all these coaches certified?
Yes. Well, you're talking about,
Yeah, all these stipends belong to certified individuals.
Are you talking about certified
They teach
under
during
their
the day,
content.
They have other duties during.
Yes.
but
They
they're
they
certified
are
for SBEC.
teaching either physical education or content area.
So they're SBEC certified.
Well, we have some that are under DOI.
Well, but they're DOIs.
Oh,
Yes, ma'am.
We don't have any TAs.
For the high school, no.
We do.
You just, yeah, there you go. Stop.
We do have a few coaching positions where they are paraprofessionals.
That's cool.
Define
So
a
do they
few.
get, yeah, do they get
Uh,
stipends?
You would know,
No, they have.
Coach Harris.
No, they get an hourly.
They're at an hourly rate, so they don't get a stipend. They're paid by the hour.
There's two.
2 years.
Two of them?
So is it more expensive to get hourly, to pay hourly?
No, it's less.
Is
Well, it is capped at what the stipend is. Once they hit the stipend level, they can't work any more hours for that.
No, we're not talking about the stipend level, we're talking about the
It is-
hourly employee.
it's
In other
not-
words, if you've got a coach that is a teacher,
Yes.
and even if they're drawing a stipend, and they go to an evening basketball game, covered under their salary and their stipend.
Exactly right.
If you've got somebody who's hourly, it can get very costly.
Go ahead, Sandy.
It used to be, so it was more beneficial to have a coach, and that's of course what we want, but in this case, where there's no one available and there's a paraprofessional, the Department of Fair Labor allows us to do a blended rate. So because we have that blended rate right, the hourly is not getting paid anywhere that a coach in that same situation is making.
So all these stipends, all these projected positions for next year, none of these are for Paris, for TAs, none of them.
They're not, with the
They're not.
exception of, that is correct, with the exception of just two that we currently have.
So
Because
where do
there's
they
no-
fall?
Okay, so let me clarify. So which are the two that are paras coaching right now?
Mario and Joseph Perez.
No, I mean, which, I'm sorry.
What position?
Middle school baseball, it was middle school football, middle school basketball.
So instead, those stipends right here are not paid out, but instead, that money is used to pay the hourly rate for that.
It's the same thing.
So it's basically,
They already get
yeah.
the stipend.
Yes, it's just categorized differently, but yes, it's still gonna be paid out one way or the other.
Capped at that?
Capped at that,
They
yes,
would, I
capped at
think
that.
from what I understood is if their hours reach that amount, they would get paid out the stipend. But if their hourly doesn't reach that amount, they just get paid whatever their hourly was. So let's say, for instance, the stipend was 7,000,
But then when the season's over, their hourly rate, it only added up to 5,000, and they only got 5,000 anyway.
That's correct.
So that means you save 2,000 from the
Correct.
stipend.
Yes.
So that
Right.
stipend is
Allocated.
tied to
Allocated.
one person, whether, they use it or
Right.
not.
yes.
Right.
Okay,
So
so you do have uncertified people
It's
getting
encumbered
the
in essence,
stipends.
Yes.
where it's there.
Yes.
It's overtime, right?
But they're still there.
It's
Blended
overtime
rates.
when, at their blended rate,
And it's
right.
not a stipend.
It's not a stipend, it's not a
Right,
stipend.
but the stipend is allocated for
It's
that one
budgeted.
person,
It's
for
budgeted.
that one person.
Budget, but it's not an actual stipend.
Right, but it's tied to that. Yes.
Oh, what is the tennis head coach in red for?
It's because that is grandfathered.
Okay.
So we have not reduced stipends, but TASB came in and did a study, and what they did is they aligned it where everybody coaching an individual sport was paid $6,000. Everybody who was coaching a team sport was paid this amount.
Okay.
And then football is a different animal. So, but we didn't want to decrease that stipend at that time. That was the one that was actually higher than, everything else kind of increased at that time to that amount, but that was the one that was higher. And it's not higher, it's higher by a couple $100 or something like that. But when somebody replaces that, that'll be the new stipend, but until that person leaves, they're gonna get a few $100 more in your.
Okay.
For that. Thank you.
Okay, let's go to the second green.
Okay, the second green, are you talking about,
Football varsity assist, okay.
do you want to talk a little bit about that?
So essentially what it was is this last year we had 4 freshman stipends and then the 5 varsity assistant stipends. But the way I run my program and how we do it is we coach freshmen on up all together. And we'll split it in like, let's say freshman JV offense is going, while varsity defense is going, and then we flip, we have offensive defensive staff. So instead of having a separate stipend, we just combine it all to all just be considered varsity assistant, but it's also 1 less total stipend. So there was 9 stipends last year between varsity assistant and freshman, whereas it's proposed for next year would be 8 stipends.
And part of that loss in that one stipend is that that's also absorbed in the athletic coordinator stipend. That one person would not be getting a stipend for football. It would be assumed as one of their duties under the athletic coordinator.
That athletic coordinator will not be receiving any other stipend, is that correct?
Let me ask Coach Garcia that.
I think that's something I guess we would need to discuss, because when we were just talking over, my thing for athletic coordinator is doing all the extra stuff that we need to get done with our growing numbers and what we're trying to build with the program from middle school on up. That's such like a vertical alignment and horizontal alignment between boys and girls athletics, strength and conditioning for KISD, helping ensure there's equity between boys and girls sports. The spring gets very busy and our sports overlap, so sometimes soccer games at the same night as basketball games, so having someone that's gonna help that we can be at all the events and help the kids feel supported, because I do feel sometimes you get stretched thin, sometimes kids are just wondering that, oh, you're at basketball, you're not here, or you're at soccer, you're not here. At least we have a representative for both, and doing things to that nature. So that was my vision for that, is just to help with equity and everything that we're trying to do with our boys and girls athletic program from middle school on up, and just with our increasing participation numbers. All our sports our numbers are increasing. Like football was 110 this year. I anticipate it's going to be around the same or more next year. Track numbers are up. Just all our sports are just, which is a good thing. The participation is increasing exponentially. We're just trying to make sure we can accommodate all the kids so that they're getting the best out of us and the best resources and coaching and necessary things that are needed for them to be successful.
To clarify, that person would be responsible for definitely coaching football, and they would be still the equipment manager. That is stipend would be absorbed under that. They would be have duties for varsity video coordinator. They would have duties for conditioning as well. Is that correct?
Correct, yes, sir.
Coach, so we're gonna be saving, the positions that we're gonna be eliminating, they know already they're not gonna be doing this next year. Is that correct?
Correct.
All the equipment manager is gonna be gone, right?
Correct.
Freshman football is
Correct.
gonna be gone. A video coordinator is gonna be gone. Those people know already, correct, that they,
Correct.
okay. So we have a position of 13,000, but really we got 16,000, so we saved something there. Is that correct?
Yes, sir.
Altogether, you see at the very bottom how much it was last year, $347,750. Yes, it's $1,500 savings last year from this realignment of duties.
I'm sorry, but I didn't get a clear answer to my question. Is the athletic coordinator capable of receiving other stipends?
To my knowledge, yes, sir.
He's a coordinator for high school and middle school.
Correct. So he's like my vision for the coordinator, athletic coordinator was everything outside of football. It's not necessarily tied to a football coach, because if we have someone who's volleyball or track or girls basketball that is capable of being an athletic coordinator, then that's who it would be. I don't want to tie it to one sport and then you're limiting yourself on the candidate. Because to me, that's okay. To be the athletic coordinator, you have to coach football. Well, you're eliminating other potential candidates that could fit the job.
No, I'm not saying it have to be, but let's suppose he does. Let's suppose your athletic coordinator becomes your head coach. Are we looking at a $20,000 stipend?
That's it. The head coach for any sport.
Like basketball or something?
I guess that's a question.
for you.
I can take that. So potentially, yes. Because what I understand from Mr. Garcia is that athletic coordinator position would involve everything that was in football, all the things in purple that were in football, and the stipend that was in, strength and conditioning, but theoretically, it could have been the same last year with the realignment because they were receiving a football stipend. That person would have been receiving the conditioning stipend. That person could have been receiving the videographer. They could have been receiving all those stipends that totaled up to the $13,000 last year, plus coaching a sport in the spring. So that could be the same. We do have coaches that at times do have that much in stipends if they're coaching that many sports. I mean, that's just.
So I think what Brian's trying to say is, could potentially the athletic coordinator also be a varsity assistant where they're getting the coordinator stipend plus another 7,000 in assistant?
I would say.
Varsity assistant in a different sport or?
Or say football.
So I guess the way to look at it is one, let's say it was a football coach. You could get the 13,000 and the 7,000. But if you look at it this year, let's say the same coach did those same duties, they're getting the same amount, actually probably a little bit more.
So what are the duties of an athletic coordinator? Besides a videographer and.
Well, that's what I'm saying, making sure strength and conditioning is aligned from middle school on up, that it's a solid, structured, scientific plan. So where you're starting at the basics at this level, building, learning, and just adding to it each year. So by the time they're at the high school, we're more advanced and we just continue to grow in that way. Making sure, again, that there's a plan of equity for boys and girls sports in regards to not only strength and conditioning, but, structure, how are we running, the program, what are we doing, what are the needs, making sure we're helping making sure the coaches are, aligned with what we're trying to do that are on the staff. Essentially, it's just a right hand for athletics. And I don't want to tie it to football. So that's why when I say like strength and conditioning wasn't like a football position, it's an athletics position for the district. I absorbed a freshman football spot because I personally feel we don't need it because of how we coach. So so we absorbed it so that it gives an opportunity for anyone who gets that position to have that kind of the stipend, but it's not costing us more money. So the reason I took away the freshman football position was because, in my opinion, we don't need that position as far as a person because we have it on our end, and we all know how it is. Like, I know I'm the head football coach, but I'm also the athletic director. I'm not going to just keep the football stipend just because I'm the head football coach. If we're not using it, and I feel like we don't need to use it, I'm not going to keep it. I'm going to get rid of it and put it elsewhere where it can benefit, all the kids. But to your question about the athletic coordinator, so making sure there's, like I said, the vertical alignment, horizontal alignment. One thing we started talking about, and I talked to others about, is even starting at the elementary level, like when it's volleyball season, have PE coaches teaching them basic volleyball skills, basketball season, all that stuff, so that by the time as they're going up, you're just building on the foundation and adding to it. And I feel like that's how it can be successful. And then another thing is, from my vision is the athletic coordinator, they have their sport they probably want to coach, it's their favorite, but they won't coach other sports so that they can help cover when we have things going on. I say, in the spring too, it just, with everything that gets so busy, I'm trying to support other kids, but like last week, I'm at golf 2 days, I'm at track 2 days, but we have someone that can kind of help out while we're at those events and things like that. And again, we're hosting playoff basketball games, where we got soccer games going on at MOPAC. It's not on campus, but we're able to kind of help and cover all those things instead of having to run back and forth. It's just really, with the way we're growing, with our participation numbers in athletics, I feel like it's something that's needed, but I don't want to tie it to a specific sport, because I feel like if you tie it to a specific sport, you limit your pool of who can potentially do the job.
So, Mr. Garcia, you did mention the head football coach. That's you.
Correct.
So you get that stipend on top of your AD sticks.
Correct, yes, ma'am.
I thought the AD before wasn't doing that. He wasn't.
He wasn't doing
Yeah.
baseball. He wasn't
No, he-
doing the baseball.
But-
I know he wasn't getting the baseball one. I remember that because he was doing head baseball and head football. I can't not recall, so I'll have to look to see if he was getting it.
Because I thought that was,
I-
we had talked to him about not to.
I think what we need to look at is, we brought Mr. Garcia in to change his whole thing around. Okay, and we saw the change, and we know it takes time. We allowed him and we gave him the reins to run his program the way he thinks is best for the athletic program, not for the football program, not for the softball program, but for athletics in general, KISD. So he's coming, he's looking at where, you're working within your budget. That's your, he's not coming and asking, I think what we're probably concerned, and I'm not, but maybe what I'm hearing is that we don't want you to come back later on, hey, I need more money because of this. That's not what I'm hearing here. He's taking the money where he can stop some program or some positions and use it for other things. So keep on doing that. Yeah, and we're here to support that. I mean, that's one of the big things why we brought you in.
Any other questions on the athletic stipends before we move to the academic stipends?
So do we vote right now? I'm ready to
Oh, no, that's all right.
Try.
Okay. Getting used to this new microphone. All right, if we could look at, if you could blow it up. It's mostly staying the same. We're looking at a few new stipends in special education areas because those are an area of high need. So you see the stipend for diagnostician and SLP lead, $750 for two of them, one diagnostician lead, one SLP lead. Scroll down further. Keep going, keep going. Okay, you see some more in green here. We see special education and dyslexia teachers. The reason why that's in green is because last year we had 30, this next year 33, because last year the dyslexia teachers did not get one. We're proposing to add 3 dyslexia teachers on there to give them the stipend as well too. Speech language pathologists did not get a stipend last year. We're proposing $2,500 for 3 of them. That is the same stipend that diagnosticians already get. Speech language pathologist assistant, half of that, $1,250. Scroll down, that might be all of the changes, but mainly the changes here are because again, we're worried about losing those employees. Other districts now have started offering stipends for those same areas to keep those high need special education positions. So that one is an increase for those. So you see last year, it was 528,000. This year proposing 545, just because again, we are adding on those additional stipends. And again, the need is because we have to be competitive with other districts and it's really hard to fill those positions.
I have a couple of questions, Dr. Schultz. Are you also basing this on comparable studies like you did with some of the other ratios you did?
Salary studies.
Salary studies, well, there's stipend studies, but yes, we look at other districts, what are they offering for similar positions?
Okay. So some of the things, this is really confusing to me because it doesn't seem like there's a rhyme or reason to some of these based on
Sure.
The size of certain organizations. For example, the ag stipend is 5,000, but we don't know if they're gonna have 10 members or 30 members, but it's still gonna be, 5,000. Whereas ROTC, it's 3,000, and I know they're a pretty big group. And where choir, they could have 5 choir members or 40 choir members, and it's still gonna be 1,000. And then you got SPED, which you have 16 of the 1,000. I mean, most people really work hard. I think it should be way more than 1,000. And they just work their tail off.
The SPED stipend is for, Okay, so let me clarify. For special education, all teachers get $2,000. Like if you go down to special education, there's a special education stipend for $2,000. But then there's an additional $1,000 for teachers that actually have kids in their classes. And in those areas that have really high need students, like for instance, inclusion teachers, they get the $2,000. They're not in the classroom all day with the high need students. The AE teachers, they get the $2,000 for being special education, then they get an additional $1,000 on top of that for being in the classroom with the high need students. So there's two different stipends for them. As far as the ag stipend being $5,000 and the ROTC being $3,000, those type of stipends, those are based on what other districts it's competitive with other districts, and the reason why is not necessarily how many kids are in the program, it's based on how many different competitions that they have to go to. Ag has so many different competitions that are going on throughout the summer, and that's why competitively, to be competitive with the other districts, we have to offer the $5,000. So it's all based on what, I guess it's called market value for that particular position, not necessarily on what we feel like. Every single teacher works hard, we know that, but to be competitive with other districts, this is what we have to offer to be competitive for market value at other districts.
ESL,
Go ahead.
do we have 9 certified teachers in ESL? Those are the ones that get the stipend?
We have a way more than 9, so we have like 1 at every grade level at the elementary schools. And then we have a few at the middle school and a few at the high school.
All right, when we go to something like a diagnostician, this is not a teacher.
Correct.
Why wouldn't we just adjust the salary? Why would there be a stipend as opposed to a salary adjustment?
Well, I can answer that. Right now, the stipends are what other districts are offering because there's a shortage right now. It might not be something where in the future, it's like stipends are year to year based on the need.
I hear you. Point to any that have gone away.
And diagnosticians are so hard to find,
I
and
mean,
if you
any
don't,
stipends
if
that,
it's a stipend,
Well-
it doesn't get reported to TRS.
Some of the, like the diagnostician is a new stipend. We just had it last year. We just added it last year because it's a high need one. If we get to the point, Mr. Kufal, where I agree we've had the stipend for 4 or 5 years and it doesn't look like it's ever going away. But coming out of COVID and being a new stipend, I think that the safer, because you're right, if we added it to the salary, it's there. It's never going away. Like we don't have the option, at least every year right now with these, we have the option of doing that. And,
Sometimes advertising also, they're looking for that.
Right.
You know, well, this district's offering a stipend for this, or this district's offering a stipend for that. For some reason, it's enticing. We've noticed that.
Or if the employee wants to change into another position and the stipend is included in their salary, then it doesn't make it comparable to another position because it's included. So it gives us a little bit of an advantage to have it as a stipend versus it in the actual salary.
for when they move to
For when
another
they, if
position,
they're
possibly
interested
in
in,
the district.
right.
what is an elementary club?
So, an elementary club, like I can give some examples, but for instance, like, what is it called? The mini JROTCs, the Ballet Folklorico, the running club. So,
That
what-
voice group that we have.
Are they limited to 3 per campus?
yes, because before, instead of just saying, hey, every campus has to have these 3, we have given the campuses flexibility to choose their own 3 clubs.
Dr. Pitts?
Yes, sir.
UIL event, there's, I guess it's 25 different teachers at $1,000 for 25 different events, or?
It could be more than one teacher that does more than one event. And again, those are based on market value of what other districts are paying for their school.
So to borrow Mr. Kupal's, term, there could be double dipping there? as
There
well?
could be, and I think, Dr. Farah, how many did we limit to, 2 or 3 or something per?
They have at least 2, like they can do 2 because they have to have practices a certain number, at least at the elementary and middle school. They have to have a certain number of practices per week and they have to sign paperwork and then they submit that paperwork to us before we, give them the stipend. They also have to attend the UIL event, like it was at TM this past year, and they have to help. And then next year we host UIL, so we're gonna need to make sure that we support that.
And Dr. Farah, more importantly, is it comparable to other schools in our area, school districts?
I couldn't say because I haven't looked at stipends for UIL. I can't answer that one. That I don't know.
Oh, because to be able to be
I would look
competitive, if
at
it's
it.
more, we should think about it
Yeah.
more. If it, if it's less, then.
Yes, I've looked at it and we've compared it. These are
Um,
based on market value.
Many years ago, teachers didn't get anything. So this is, it's getting better for
Right.
teachers that.
And it's not like they're
They can do it for free.
Never give it one kid.
Yeah, but it's one kid. It can be, one kid, but that's like.
Well, if the event doesn't make it that campus, typically if it is just one student, we ask them to coach a different event instead of that one event or combine 2 events into one session. So they don't get double dipping on those types of stipends. They do have to have a minimum number of students. I do need to look into the high school, however, and make sure that I'm on top of that.
Any other questions on the academic stipends? Okay, we have one more item, and this, thank you for your patience. I know there's a lot of difficult discussions because of where we are right now. But the last one that we're gonna talk about is time clock, but it affects the budget. And I'm gonna talk about how it's gonna help our district moving forward. Time clock is a system where employees punch in and out for their time. So it takes a lot of manpower, and there's gonna be a way to streamline, and that's what we're doing to take less manpower, because right now, we have employees that are having to sign their timesheets every week. We have secretaries that are having to check it every week. We have principals that are having to check that. Then we have human resources that's having to check that. Then we have finally payroll that's having to check that. A lot of it is on paper right now, and we're looking at going paperless. There's gonna be a little pain going paperless. So I'm telling you ahead of time, but it's going to save a lot of man hours in the future. So right now you see on there that the problem right now is some employees are not always clocking in. And that takes a lot of time it doesn't seem like a lot for one little check-in, but across the district, the mistakes that leads to and the manpower for correcting all of those across the district is costing us a lot of money. So we are implementing some things that are gonna help in that. The first thing that we're doing, so the process is that every employee, every day they clock in, and if they're an hourly employee, they clock out as well too, so it can track the number of hours. Then at the end of the week, they approve their time on the time clock, they look at everything, was this correct for the whole week, and they're approving it, there is like their signature that they're doing it. But they're doing that now, and they're doing paper, because we used to only be doing paper. But now they're doing a hybrid. They're doing both because we're trying to catch all the errors before we move completely digital. Because otherwise that could be a nightmare with people not getting paid correctly. So now we're looking at finally going 100% digital, which is going to save all this time. But right now there are still errors. And what's going to happen is that employees are going to we're going to do training at the beginning of the year, and we're probably going to do that with admin and auxiliary over the summer. So we can kind of do a pilot group and let them know, this is what you're expected to do. You have to clock in, you have to clock out, you have to, at the end of the week, check it to make sure there's no errors. And it's very important now, because if you don't do it, what's going to happen is you're not going to get paid for it. And we will go back the next paycheck and we will pay you for it, but, you are going to have to make sure you are checking it. And right, yes,
For the old people.
okay.
Tell me what clocking in and clocking out means, because I'm from the age where there was a
Okay.
physical punch
Right.
on a card.
They have their fingerprints, so they know that it's them.
Okay.
And then they have a code that also makes sure that it's that person clocking
Is there
in
any way
and
to
somebody else.
tie to their ID tag?
Somebody else could bring their ID tag in and you think that that wouldn't happen, but
We've already been on biometric for the last
Okay.
10, 15 years, so that
All right.
initial part has
I'm
already,
good, because I was
no.
just concerned that physically you had
This is
people
just-
lined up like Fred Flintstone.
This is just holding them
Punch it down,
responsible to the
Fred.
next level so that we could interface and do away with the signing of the timesheet.
No,
We're wanting to take it to the next step.
So everybody clocks in, even
Everyone clocks
contracted
in.
people?
contracted people clock in as well too.
We don't clock out.
We,
Everyone.
I think it's good for safety.
we only do the hourly. They're the only
For
ones, 'cause they're the only
accountability.
ones that we worry about their hours.
What happens with that is if you need to leave, if you ever need, we gotta prove that you worked the 1,260 hours. If you're not clocking in, I don't see how districts are proving that you worked them. And that's the law, so, but it's worked for us for the last, I think, 15 years.
The other thing that this does is we don't have to manually with professional employees. We know exactly who's there based on their finger, and it will go automatically to payroll, automatically to leave. Everything's being automated, where now you don't have to do it with paper. So with your finger, there's no question, this person was there at that time. Now, again, what we're looking for is we're looking where it comes automatically to their phones now. We're getting an app where people can have it on their phones where they can't clock in from their phone, but they can check their time from their phone and then identify if there's a problem. Right now, they have to go to the time clock to see if there's a problem. But this will help where every employee, and we're gonna educate them that, hey, at the end of the week, every week, if it says it works 40 hours, and you have 37 hours here, you better fix it before the deadline, because otherwise what's gonna happen is you're gonna be docked. Now, if later on they can prove that they were actually there, we will fix it. But what's gonna happen is by going automated, it is gonna save so many man hours by going automated. You wouldn't believe that secretaries probably spend 30% of their job on paper timesheets. And HR has like one person that's dedicated toward timesheets. And also we have one person in payroll that probably spends 30 to 40%. By automating, moving forward in the future, it is gonna save a lot of man hours and will eventually allow us to decrease staff because so many people won't be wasting time on manual timesheets. The reason why we're telling you is there's gonna be short-term pain in the front load. There's gonna be someone that's gonna say, hey, I went through the training and everything, and I did not clock in, and I did not put in an absence, and I didn't check my time at the end of the week. Like all these safeguards that we have in there, they're gonna say, hey, I didn't do it, and can I get paid? And we're gonna say, sure, we'll pay you. We'll pay you for that day that you missed next month, because you didn't do what you were supposed to do. So, but again, we're gonna educate well. There shouldn't be problems, but right now, again, it's all about education, but it's gonna be about saving employee man hours in the future.
And making it as convenient as possible by putting it on.
Yes, putting on the phone.
What about large events? You know, do you ever run into a problem that you have a long line of people, you know?
We do, and on that, we have made exceptions and actually done paper, but it would be great if we could, do something where they could do it digitally, technology, not wait in a long line.
Yeah.
This is for large events.
At convocation, each principal and secretary is expected to have their clipboard
Yeah, this thing.
with their sign-in.
But that does take a lot more work for us, so we don't want to do that every day for sure.
Well, no, but like at large events, it's not all the time, once in a while.
And then we just mass import.
Yeah.
Once you've attested that the employees that were there and the ones that were not, then we handle it on the back end so that it's not work for the secretary.
Well, that's good.
Dr. Pitts, do we gotta change our policy to say that they will not be getting paid if their time clock is, if the time sheet is not corrected or something? Would that be something that?
Oh,
would have to be-
right. I guess I shouldn't have said docked. A leave is docked. Like, in other words, a leave day would be taken away. They're only docked if all of their leave all the way across the board is taken away. But let me defer to Mr. Maddox on that.
There we go. First time using a new mic, okay. So the administration can give notice by regulation, but ultimately it should go into our DC, our policy series. Yes, sir. We don't have to hold up progress by waiting for all of our readings, but it should be reflected there.
But ultimately, right now, the employee signs on paper that, hey, this is good. I'm attesting that these are the hours I worked this week. They're gonna be doing the same thing digitally. That fingerprint and everything, that's their digital signature, so they are attesting to that. So even if they miss on the day, they should catch it by the end of the week. And they will be able to check on their phone, hey, I don't have 40 hours for that week, so they will be given every opportunity to fix that. And even afterwards, if an employee did not do what they were supposed to do, like with those 3 checkpoints, we will go back to the next month. We're not gonna cut a separate check for them for that day, because that would, if we had to do that for every employee. But what that's gonna do is, before in the past, they have never been held to the fire. And that's the reason that we haven't gone digital in all this time. Digital, because what's gonna happen if we go digital, then their mistake is they're not gonna get paid for that particular day. But we can't let that hold up progress anymore. So we just have to move forward.
And we should also update our employee handbook as well.
Okay, thank you.
So that would reflect in the handbook, then if you didn't clock in, that's your mistake, you won't get paid till next.
So you'll get
And
doctor,
you can legally
whatever.
do that, your labor.
You can, as long as you're requesting it back. It's
Okay.
hard to get one back.
Okay. And they still wait till the next month anyway, right?
Yes.
And they're gonna have they're gonna have a couple of weeks, 2 to 3 weeks to find that error. So it's not gonna be that they're not gonna get paid. It's time. So we're already testing the app. Employees are gonna love it, because they're not gonna have to do it on the time
Oh,
clock.
it's crazy.
When they come into work, they're ready to work. When they're ready to leave, they wanna go home. Now, at the convenience of their phone, everybody's addicted to the phone. When they're sitting, they can just go look and approve. They're gonna like that a lot better than having to stand at the time
And
clock.
then they have time to correct. in
And
case
they have,
missed
there's a
something.
3-week window.
Oh, perfect.
But
Yes.
how did they
Yeah.
correct it? They worked,
They-
they missed, or they forgot to clock in
Well,
or whatever?
There's employees who work a lot with oil, or like custodians with all the cleaning supplies, or if you wash a lot of dishes with Clorox. Eventually, sometimes it doesn't take your finger, you walk away, you think it is. You clocked in, but you didn't clock in because you didn't see it finalized. It's those types of circumstances, but with them looking at their time all together in 1 week, they're gonna be able to catch, I don't have a clock in for this day, and then take it up with their supervisor, who in turn will make the correction with us.
But it's not just gonna be, oh, you forgot that day, oh, you don't get paid. It's gonna be like, you forgot, you have these couple of times to correct it, and you have a chance to look at it and verify it. And if you look at it, if you forgot and you verify it anyway, because sometimes people, right now, people are not looking at it and verifying it like they should. They need to know that they really need to look at it and make sure that it's correct before they verify it at the end of the week.
So if you come in and say, I'm gonna be late this morning and I'm coming in at 9:30, but I'm gonna stay till 6:30, does that count?
Yeah,
They
yeah,
don't
it
have
actually
time
does,
again?
for hourly,
Yes.
yes, yeah, sure does.
But that's just for hourly?
For the professional employees, they're just, that they're there, they clock in, so if they prove that they were there, and then they're not hourly, so they don't clock out.
Okay, okay, I get it.
Oh, that's a good.
Yeah, that's good.
All right, any further questions?
It's not a I gotcha thing. You see, a lot of people think, oh, I gotcha. No, they gotta see the end product over here all the time. They do all our wasting trying to fix these things up.
It'll be easier on them.
It'll be easier for you
It
guys.
will once we get the app going this year.
All right, there being no further workshop items, we are adjourning the workshop and returning to closed session. Under the same authority recited previously in the meeting, we are entering closed session for the second time at 8:40 PM.
Can you stay there?
You can't